Welcome back. There has been a tangible rebound in COVID-19 infections here on the local front. And for more on this trend here, that is, and elsewhere across the world, I have Professor KIM Moon Kyu from Yonsei University. Professor Kim, welcome back.
Thank you for having me.
I also have Dr. ANIKA SINGANAYAGAM at Imperial College London live on the line. Dr. SINGANAYAGAM, it's a pleasure to have you with us.
Thank you very much.
We'll start here then. Professor Kim, there's been a tangible rebound in daily COVID-19 infections here on the local front in recent days. How do you explain this unfortunate scenario?
Well, we eased our social distancing somehow, and I think the virus is trying to pick up every person who is not immune. I mean, who's not infected, who's not vaccinated. And maybe we have a new subvariant called BA.5 emerging. I don't know how much is affecting in Korea, but there is that subvariant over there. And actually, there was very few unnoticed infection before Omicron. But now, since the health authorities proved that rapid antigen test as a screening method, more tests was conducted and more cases confirmed. But also there were a lot of false negative results that's making confusions. Anyway, the Korean study tells that the reinfection rate is only about 0.35%, and it was about 3 times higher since the start of Omicron outbreak. If I compare with Italian study, they say about 6.7% of reinfection. So I think Korea is doing very well. And I would like to mention about Denmark, because we have a lot of similarities with Korea. We are in the same situation like peninsular, and we did very well with previous mutations. But we had a huge spike because of Omicron, and I think we are about 1.5 months ahead. They are about 1.5 months ahead of Korea, so they are already showing a mild increase. I think Korea will follow that pattern for some time.
Right, I see. And Dr. SINGANAYAGAM, I understand the UK is also witnessing a resurgence. What can you tell us about the rebound there and the reasons behind it?
So that's correct. In the UK, we are seeing increases in case numbers. And it seems like most of these infections are with the BA.5 Omicron subvariant. So we're seeing that is spreading widely. It's causing a new wave of infections here in the UK. The BA.5 is very contagious. It can evade immunity. So we're seeing infections and even reinfections occurring in those people who may even have been infected with Omicron and with an earlier subvariant. Also, we're seeing some infections there. Also, it's in the UK, it's summer here. We have almost no COVID restrictions. We have large events happening. And so there's a lot of potential for the infection to spread.
Right, I see. Professor Kim, here in South Korea, the recent uptick in cases has fortunately not led to an uptick in critical cases nor fatality rates, as of now, that is. Do you expect a shift in this reality should caseloads continue to climb?
The case will increase, but as the antibody positivity rate in Korea is about 95%, that is a good news. And Korea has one of the highest vaccination rate in the world. So as vaccine can prevent hospitalization and mortality, even though we are experiencing this increase in number, mild surge, but I don't think the case fatality might rise. If only the people who are not vaccinated or people who have underlying conditions take a good care of themselves.
Right. Dr. SINGANAYAGAM, I understand in the UK, COVID-19 related hospitalizations have jumped in recent times. Do tell us more about this surge. And the mask mandate, I understand, has been imposed by some hospitals there to cope with this particular challenge.
Yes, that's correct. So the data here in the UK does show increases in hospital admissions with COVID. We also try to monitor critical care admissions and deaths. Unfortunately, so far, we haven't seen a rise in deaths or the more critical cases with COVID-19. But these are things that can sometimes lag. So you can see cases increasing, and then later you see critical admissions and deaths increasing. So it's something that needs to be carefully watched in the UK. And as I mentioned earlier, most of the COVID-19 restrictions in the UK have been dropped by the government, including mask mandates in hospitals, which were dropped about a month ago, meaning that visitors and staff in hospitals are not mandated to wear masks around the hospitals. But with the increase in cases that we've seen recently, some hospitals have taken infection control decisions to reinstate a mask mandate to try to limit transmission there. Particularly for hospitals, this is important because we can see lots of staff absences because staff will catch COVID and need to isolate. And this causes big pressures on the healthcare system. Also, if we see lots of COVID hospital admissions, even if they are on the less severe end of the spectrum, this means hospital beds are filled up, particularly isolation beds. And this limits our ability to treat other conditions that we need to. And so these are important problems for the NHS, which is the healthcare system in the UK. It's an important thing for them to consider.
Right. Please go ahead.
In the UK, we have a large portion of the population who have immunity, so antibody, either through previous infection or vaccination. So I think up to 99%, and about 85% of those have had 2 vaccine doses. But we are rolling out boosters to the elderly, and this will be key in trying to make sure that those severe cases and deaths don't start to rise. We have seen a reasonable uptake in the elderly vulnerable populations, but there are still elderly and vulnerable populations, about 1 in 5, who haven't had their boosters. And so these sorts of things are key measures to try to make sure that those hospitalizations are not severe disease.
Right, I see. And Professor Kim, here in South Korea, outdoor mask requirements have been lifted for a while now, but the indoor mask requirement remains in place. Do you perhaps see a return to stringent COVID-19 restrictions if the daily caseloads continue to escalate?
Well, I think the wearing mask outdoors have not enough rationale. I think it's very minimal, and epidemiologic studies says that most of the transmissions happen in indoors or confined space or very crowded places. But as I told you, unvaccinated people and people with underlying conditions has to be more careful, and not only the hospital but also the nursing homes should be very careful not spreading infections. And the reinfection in Korea happens more often in the elderly group. So that is one of the reasons we have to be careful.
Right. Dr. SINGANAYAGAM, what are the prospects of tough, perhaps, COVID-19 restrictions there in the UK should caseloads related to hospitalizations and fatality rates escalate?
At the moment in the UK, I think we have very little political appetite for reintroducing any tough restrictions. The government say that they're watching the critical care admissions and watching the fatalities, and it's only this that would prompt them to reintroduce any restrictions rather than the case numbers. But I think, rightly as you say, if we do see any signal of increases in fatalities, this is something the government would have to respond to. But likely, because there is a lot of concern about the economic impact of COVID-19 restrictions, I imagine that they would start with those restrictions that have less economic impact and probably escalate depending on how the response goes.
Right, which would also be the case here in South Korea then. Professor Kim, the Yoon administration has spoken of boosting the number of one-stop COVID-19 medical centers for testing and treating from the current 6,800, I believe, to about 10,000 nationwide. Is this adequate?
I think it's enough, and actually we are entering a new phase of a pandemic, and most of the people either vaccinated or infected with Omicron. It's something different from other countries because they might have a lot of variant exposed, but Korea is almost infected with Omicron, and if severe cases do not rise and until we don't have a new variant emerging, I think this will be enough. But still, we need a mass scale of survey for antibody test because we had a very small study. And we need molecular studies for new emerging subvariants. And still, we have to be vigilant for new variant emerging. And lastly, we need a prospective study for long COVID.
Right, which is still ongoing, I believe, by the government then.
Yes.
Dr. Singanayagam, London this past Saturday hosted the Pride Parade, which marked its 50th anniversary, I believe. Now, what were some of the precautions, perhaps, for those participating in the parade amid the rebound, of course, in COVID-19 infections there?
Well, the UK policy here is still one of living with COVID. Is how it's described. And so we have very few restrictions on normal life. So people are not mandated to wear masks outdoors or even indoors. And there's no mandated self-isolation for people in the community. The government do recommend people stay home if they're unwell. They'll give general advice about washing your hands, keeping your spaces ventilated, wearing masks if it's crowded, but this is up to the individual. And so for the Pride Parade or for other large events that we've had here recently, there's also been the Glastonbury Music Festival, which is a very large music event that happened recently. And we also have the Wimbledon tennis event. So there are lots of different large events happening. And probably these have stimulated the increase in COVID cases because they have occurred without there being COVID-19 restrictions.
Dr. Singanayagam, for the sake of clarification, a person who tests positive for COVID-19 in the UK is not required by law to isolate. Is that what you were saying?
Not by law, no. It's just a recommendation.
Is the exception then in place for perhaps medical care workers, healthcare workers, that is?
For hospital and care workers, they will be asked to self-isolate and then take lateral flows as a test to release yourself from isolation if you have 2 negative lateral flows on day 5 and 6. So that is applying still to the healthcare workers, but not to the general population.
Right, I see.
Although, some people will be following that, it's not mandated.
Right. Professor Kim, amid the latest rise in COVID-19 cases, what is the medical advice that you would have with regard to COVID-19 boosters? I'm talking about second boosters, which is something that the government here is currently discussing.
Mm-hmm. At the beginning of this vaccine program, there were many reasons that people would not want to get vaccinated. And they worry about it. And the RNA vaccine was quite new for the whole world. But we now know better about those vaccinations. But there are still unvaccinated people out there, and but we still have more options when we choose what kind of vaccine we're going to take. There are more companies out there. So if you experience side effects from the previous vaccines, or you just worry about it, you can find new vaccines with less side effects, such as Novavax. And if you are fully vaccinated or recovered from Omicron recently, I think we can wait for a few more months because I don't think immunity will evade very fast. So they say, somebody says about 6 months, and some scholars say we can even wait for 1 year. If a new variant emerges, or if you have underlying conditions, you might need a booster before immunity evades. So I would recommend those groups actively consider about the second booster dose.
Right, and staying with vaccination, Dr. Singanayagam, infants as young as 6 months old are now eligible for COVID-19 vaccination over in the US. Do you see the UK adopting a similar campaign? I mean, do you believe this vaccination campaign is essential as we perhaps chart a new normal amid COVID-19?
So in the UK, we we offer the vaccine to children over 5. And so if children over the age of 5 wish to take up the vaccine, then that is available. However, we haven't yet extended it to toddlers, so children under 5. I think this is something that the UK will be watching closely in the US, weighing up the risks and benefits. Of course, in small children, the risk of severe illness and death is very small. And this is one of the key reasons that we vaccinate, to protect people from the severe illness and death. The vaccines, unfortunately, aren't very good at preventing you from getting infected with Omicron. It doesn't offer very long immunity from infection, although the immunity against severe illness and death is retained. And the other thing to consider is that vaccination in adults has been shown to reduce the risk of long COVID. And so these are all the things that the vaccine decision makers need to keep a close eye on and think about when they review their decision for the even younger children. It's likely in the UK that this would be offered but not mandated if it were to be offered.
Right. And Professor Kim, as a pediatrician yourself, what are your thoughts on efforts to provide children, toddlers, with vaccine-induced immunity against COVID-19?
Actually, RNA vaccine gave a huge help overcoming this pandemic. But since the emergence of Omicron, vaccine was not that good enough to prevent infection, but still was effective in preventing hospitalization and mortality. Currently, Novavax is approved over the age of 18 and has a far less side effects. And I hope that we can have a sizable study with Novavax with age group less than 18 and further on. And as I met some parents, it was very, very hard to persuade them to get vaccinated if they had a congenital heart disease or previous conditions. They were not willing to take a RNA vaccination. So, but if we can say that Novavax is as safe as DPT or pneumococcal vaccine or Haemophilus influenza, I think most of the parents will agree to get vaccinated.
Right. Dr. SINGANAYAGAM, I understand this is going to be the million-dollar question, but how long do you suppose will this vicious cycle of rebounds and retreats and daily COVID-19 tallies last, do you think?
I think that's very difficult to say. We're still seeing ongoing rapid evolution of the virus, and high case numbers are driving that. So the more infections there are, the more opportunity there is for the virus to evade our immunity, to try to go on and transmit and infect more people. So it's very difficult to say how long that will last. It's likely we will continue to have waves and there may be new variants that emerge. The key thing is to really monitor the data, have sequencing available, have good testing policies, and to monitor hospitalization numbers and deaths in order to be able to respond to signals that might indicate that vaccine-induced immunity is becoming less efficient. However, I think it's very difficult to say how long this will go on for. It's completely novel to us. We haven't had a previous coronavirus pandemic, at least in the last 100 or more years, that we have to compare. And so I think we need to be vigilant.
Right. Dr. SINGANAYAGAM, going back to something that Professor Kim had mentioned earlier, what is the latest with regard to long COVID, perhaps, research on long COVID over there in the UK? Is there something you could share with us about that?
So there is some new data that shows that vaccination is effective at reducing your chance of getting long COVID. We also have some studies that have tried to compare Omicron with previous variants like Delta, and we see some reduction in the risk of long COVID with Omicron compared to Delta, but that by all means doesn't mean that the risk is completely gone. We are still seeing lots of people affected by long COVID, and the implications of that on the workforce and the economy are great. And so we need a lot more research into this to understand what's the cause and what to do about it.
Right, which is something that Professor Kim had also mentioned as well. All right then, Dr. SINGANAYAGAM, thank you so much for your time and your thoughts over from the UK. And Professor Kim here in the studio, thank you very much for your insights.
Thank you.
Thank you.